Ethics 13. Imagine you are working as a resident in a busy hospital and you have just admitted an elderly patient who only speaks Arabic. You are feeling the pressure of time and you notice a colleague from another team who is fluent in Arabic grabbing a coffee in the break room. It seems incredibly efficient and convenient to just ask them to come over for a few minutes to translate the history and physical, doesn't it? It feels like you are solving a problem quickly, and you might think it is a helpful way to bridge the communication gap without waiting on hold for the hospital's official interpreter service. But here is the critical point you need to remember for your USMLE Step 3 exam. You absolutely should not use your colleague as an interpreter, even if they are fluent in the language. The standard of care requires that you use a professional, certified medical interpreter. Think about the risk involved here. First, there's the issue of clinical accuracy. Speaking a language conversationally is completely different from accurately translating complex medical diagnoses, treatment risks, or informed consent discussions. There is a huge potential for critical information to be misinterpreted or omitted. Second, you are dealing with a significant HIPAA concern because you are involving an unauthorized person who is not part of the direct care team for that specific patient, which compromises confidentiality. Finally, you are pulling a colleague away from their own responsibilities, which potentially harms their patients. The correct action, even if it feels slower or less convenient in the moment, is to immediately access the hospital's designated medical interpretation service. These interpreters are trained to translate medical terminology, manage the flow of the conversation, and maintain professional boundaries. The only exception to this rule, and this is a classic exam caveat, is in an absolute life-threatening emergency, like an active code or a massive hemorrhage, where every second counts, and you genuinely have no time to wait for a service. But in any routine or non-emergent clinical encounter, you must always choose the professional interpreter over friends, family members, or other staff members who happen to speak the patient's language.